Okay.
Okay. Good morning, Ashley. How are you doing?
Good morning. Good. How are you?
I'm very good. Thank you. I'm going to read your, whoops. Oh my goodness. I'm going to read your bio here as soon as I pick it up. And then if there's any information you would like to add to it, then you can add any additional facts.
Okay.
So Dr. Ashley, how do you say your last name? Denoy? Denoy. Okay. Is a women's health and orthopedic physical therapist located in Greenville, South Carolina. Dr. Ashley graduated with her doctorate in physical therapy from Bradley University in Illinois. She has 7 years experience in outpatient ortho, treating various musculoskeletal injuries, neuromuscular conditions. After having her first 2 children and seeing a significant need for women's health, focusing in pregnancy and postpartum. So true. Dr. Ashley started Bodyworks Physical Therapy. She hopes to bring awareness and restoration to women on common but not normal issues. That's so funny. I totally just said that the other night in my yoga class because we were working on stretching the quadriceps, and it's very common, almost normal for people to have really tight quads, and everyone's like, oh, this is so normal. I'm like, no, it's not normal, it's just common.
Yes, so true. It's just because we're sitting a lot of the time, during our day, and then we go to bed, and so we're not up moving very much. So that's why a lot of people have those tight quads.
Yes. So tell me a little bit more about your area of expertise in this women's health.
So I see women, primarily pregnant and postpartum women, and any areas such as diastasis rectus abdominis, incontinence, pelvic organ prolapse, low back pain, if they're having any sciatica. I typically see those types of patients, and just really focus on getting them back to what they want to do. So whether it be yoga, CrossFit, we have a lot of bar and Pilates places around here. So a lot of those women, I see a lot of active women. So just getting them back to whatever it is that they want to get back to.
Yeah, no, that's wonderful. Do you see women right after the pregnancy, or can it be like years later? Let's say they had a cesarean and then they're starting to put their sciatica together with that surgery.
Yes. So I see women in pregnancy. I see them right after. Sometimes I can see them actually right after they deliver, because it's okay to start doing some pelvic floor contractions immediately after birth. And then I also see women several years postpartum. So I'll get somebody that, had a baby 2 years ago, or I've had a couple of people contact me 6 years after, and they're like, is it too late? And the answer is no, it's never too late to start something. So just like getting back into any sort of fitness, you'll be sitting around all day long just waiting for the right time, but start today.
Yeah, exactly. That's wonderful. That's good to know. I didn't know that you could start right after birth. That's really good news.
Well, yeah, it's really good news. You just want to, it's not something that you're going to want to continue. You don't want to start lifting those weights right after. It's just more just to get those muscles. It's almost kind of like if someone has a rotator cuff injury, it really just depends on what the doctor prescribes. So some doctors, they want you to wait a couple of weeks to actually see a physical therapist, but there are some people that have a rotator cuff repair and they want you to be seen that next day. So just to get them moving. So it really just depends. So, ask your midwife what their suggestion is, or your OB/GYN what their suggestion is. But yeah, you can really start doing pelvic floor contractions that first day.
That's good to know. So as you're working with a lot of these women and helping them return back to what they love, whether it be Pilates or the bar or yoga, you're hearing a lot about wellness. So what does wellness really mean to you personally?
So I think wellness encompasses a lot of different areas. So it's really just about balance, eating well, and just doing what the best thing is for you or for your patient. So I've seen a lot of people recently, and they are very focused on what they look like, their appearance. They've like, I don't look like I did before I had a baby. And, or they see, things online and, seeing people coming back or, moms in bikinis and things like that. And I just really try to help them focus on their wellness. It helps to restore their confidence, and just to focus on what works best for them. So wellness really just encompasses a whole bunch of topics, such as doing a little bit of a workout here or there, if that's all that you can fit in. So a lot of my patients are moms, and so they will think, oh, I can't fit in that 30-minute or an hour exercise. But really, it's just if they have 10 or 15 minutes in a day to stretch or exercise, that's all that they really need. And even if they don't get that in one day, just not beating themselves up for it, because tomorrow's a new day. And that's just what I think of wellness, in regards to myself and to my patients, is just balance and minimizing stress.
Yeah, I totally agree. I think what you said is so important. How a mom might look on Instagram or read in one of those, what are they called, rags? How an actress, bounced back from her pregnancy and is already in a bikini like 4 weeks later. What's that saying is like, comparison just sucks the joy, and it's understanding like what's important to them and how they're feeling, and letting go of like what other people are doing, whether it be actresses or just the neighbor down the street, because we're all different.
Yes, comparison is the thief of joy.
Yes, that's it. Thank you.
It's so true.
Love it. So what's the biggest tip you find yourself giving to a lot of these moms?
Finding out what works best for them. So like I had said before, if it's, doing a 10 or 15-minute yoga session or stretching session, or doing an exercise, walking, riding their bike, whatever it is, it's really about finding out what works best for them, and just realizing that they're strong, beautiful women, and just to keep going, and just never give up.
Yeah, I love that. How do you work wellness into your life and your business model?
So this is kind of a big one for me, because when I've been in outpatient orthopedics for 7 years, and I decided to do BodyWorks physical therapy after I was still pregnant with my youngest. And so a few years ago, my son has some issues with breathing, and I get migraines, and I worked with a doctor in the facility that I worked in Illinois. We just moved to Greenville a year and a half ago, and she had recommended eliminating gluten and dairy, and that was just kind of just a starting point for me. So before, I was really trying to make a health switch, and I made sure that I used whole wheat flour for everything, and just things like that. And so this was life-changing for me and my family. So now when I'm looking at a patient, instead of just saying, oh, what's going on with your shoulder, what's going on with your low back, I really look at it holistically. So it's not just, let's not just look at your core, your back, but what else is going on. I just had a mom come in, and she said that she was having a lot of aching in her legs, and then her knees and her ankle joints. And so we kind of just stepped back, and, not that I didn't want to focus on, her core weakness after having children, but just taking a look at her lifestyle as far as her stressors, her activity level, what she's eating, that plays a huge role into my patients and how I treat them. So that's how I incorporate wellness into my business now.
Yeah, I love that. I do a very similar thing, just looking at the whole picture, the whole body, the whole
Yes.
lifestyle, the whole person.
Yeah. And so when I get a patient and I don't want them to think that I'm dismissing their back pain or their sciatica or anything like that. It's just, it really is huge because pain, as you know, if you have pain somewhere, it's just going to continue. I mean, you just focus on that pain when you have that. So if you step back and just think, what other stressors do I have going on, or what sort of foods am I eating that could be influencing that pain, it makes a huge difference.
It does. It's part of the component for sure.
Yes.
I love that. As a business owner and a mom, what's the biggest challenge you're having to overcome yourself?
Well, I would say that I'm still working on it, but even just this interview is a big step. So when I first started BodyWorks, I was just thinking in my head, okay, well, I'm just going to see patients. Like, that's all I want to do. I just want to see, I'm just going to be getting these patients in. I'm going to be helping them. But I didn't realize, I don't know why, maybe I was just a little naive.
Because we don't learn it in PT school.
Right. And so I didn't realize how much marketing and network I was going to have to be doing. But it turns out I love it. I really do. So I'm a very personal person, and I talk to patients on an almost daily basis. And but just going out and speaking to other women, having workshops, like I've never done anything like that except for giving presentations in PT school. So the largest group that I just most recently had was a MOPS group, and which turned out to be a really awesome experience, but there were probably 50 to 60 women there, and lights shining on me. And that was something big to overcome. So I really am enjoying that aspect of it.
Good. I've seen your videos on social media, Instagram and that sort of thing. They're lovely. So keep it up.
Thank you. Thanks.
Yeah, it is. It's doing all this is definitely a lot of fears, my own mental obstacles to overcome.
Yes. Yeah. And I mean, it's just a conversation, really. So when you think about it in that aspect, it makes a huge difference.
Yeah, love it. So how do you find just as a side note, how do you find yourself kind of overcoming these fears? Like for the MOPS group, what did you do to get yourself in the, just do it, like put that one foot in front of the other?
So I just did it.
Love it. Nike.
I want to say that I prepared, but I really did prepare. I kind of just wrote down, my notes, and I just kind of started scaling back those notes. So I wrote down exactly what I wanted to say, and then I kind of took little pieces from that. And then from that, I made little bullet points, and I only had maybe 10 minutes to speak. So I had to make sure that it was under that. And I mean, like I said, I don't have any experience really public speaking, but that's just really how I prepared. And the more that I think starting off small has been huge too. It's not something that I would have wanted to do when I first started. So when I first started having some workshops, it was maybe just a couple of people. And I think that's what really helped prepare me for taking that leap.
I think that's so important because it's a real life example, and there's other moms out there wanting to do something, right?
Yes.
And they're just having this fear holding them back. And sometimes I think that to do something but not doing it. Sorry,
yeah.
I had a phone call.
It's okay.
The wanting to do something but not actually doing it because of fear, it can, get trapped in the body and sometimes exacerbate pain or emotional distress, whatever it is. So I know personally, just hearing stories like yours, it just helps me to be like, okay, I can do this. I just have to put one foot in front of the other, start it small, that sort of thing. So thank you for sharing.
Yeah. And the other thing that I was going to say is I'm still trying to overcome the whole work-life balance. So I thought that it was going to be easier being my own boss or starting my own business. And again, it was more naive than I thought. Just
learn.
yes, exactly. But I mean, I've had just a whole bunch of changes in the last year and a half with having the baby and my son starting kindergarten and starting this business. So that's always just a daily challenge, is trying to figure out what works best for us. And we're always, my husband and I are always coming back together, trying to figure out, okay, well, this isn't working, so let's figure out what works best for us.
Oh, that's good. So that's kind of a lead in into my next question about how you incorporate some of this wellness into your own life. So communication with the husband's number one.
Yes. And also, so I make sure that I'm eating well, that my family is well fed, and that we are praying before every meal. Before I hit the bed or before I hit my pillow, I try to pray. And I also try to focus on stress, which is a daily occurrence, I would say. I have 3 kids now, so one is still nursing, and so just adding that extra child. She's only 6 months old, so just adding that extra bundle was huge. So we're constantly juggling that. And then as far as fitting in some sort of fitness or exercise, most days I would say that it's chasing my kids. But when I do, I like to either get on my stationary bike or just do some stretches, yoga poses, that sort of thing.
Yeah, such practical advice. So thank you. Well, any final parting words of wisdom for this morning?
Yes. So I recommend that all women see a women's health physical therapist, not just only during pregnancy. If they're pregnant, then coming to see a women's health physical therapist for any sort of pain or help them with any sort of functional activities. But definitely postpartum. If you've had a baby, even if it is several years, but if you've just most recently have a baby, I would really recommend getting in to see that women's health physical therapist. And if one doesn't work for you, then try someone else. It doesn't mean that it's not going to work for you. And even if you aren't having any issues, still go see someone, because it does prevent issues in the long run. And had I known what I know now with my first 2, I would have definitely done things a lot differently.
Yeah.
So get in there.
Yeah, very, very helpful. So what's the name of your business and what's your website?
It's Bodyworks Physical Therapy. My website is www.bodyworks-physicaltherapy.com. And you can reach me by email, as well as it's Ashley@bodyworks-physicaltherapy.com. And I'm on Facebook, obviously, and Instagram.
Beautiful. Well, thank you so much for chatting with us this morning and sharing your information. And I hope to stay in contact with you.
Yes, it was so great speaking with you. Thank you.
You're welcome. So I'm just going to end this recording here if I can. Okay.